Hi, YouTube family and friends. Tony Tucker hollering at you with my beautiful Aunt Dorothy, who's sitting here. Just got tended to by two lovely people, Ashley and Robert, her nurse. And what's going on in light of the coronavirus that you're seeing in the medical field? Let's start with you, Ashley.
There's just a lot of
CNA
precautions being taken, a lot of shortages on everything. People are going crazy in the stores. There's nothing left.
Mm-hmm. Yeah,
you know, it's scary.
Yeah. How's it affecting you as a CNA?
It's affecting me because, it's affecting me because my hours are now being shortened because of the daycare closing at 3.
We need you more.
At 5.
Oh, well, you have your son.
Yeah, they were closing at 5, and now it's like I have to rush and do everything.
Yeah. So it's a lot of stress, more stress. And what about you, Robert?
Well, me being an RN, I've seen it from both ends, but I'm with the home health agency now, of course you know that. So we're still getting patients. The concern for us right now is some of the home health agencies are now starting to pull back on who they accept, because now we're starting to get, what are we up to, 300 cases now? I think it's going to shot up to thousands now or something. It's happening quickly.
Crazy.
But a lot of the agencies are now holding back. I know with our agency, we're making them do a test, the COVID-19 test first before we can have any of our staff go in there. As you saw me use gloves. Usually I do a mask. I know Miss Dorothy hasn't been hospitalized recently, but as far as outside, I wouldn't say it's a ghost town. It's different. I am seeing a lot more police presence. That's kind of odd. That's got me a little concerned.
Yeah.
In a good way, I guess.
Yeah.
But
it is something to make you go, what's going on?
There's
with
something
the
definitely
added.
going on.
Yeah,
So,
absolutely.
We'll see. I know from a medical perspective, we're waiting because a lot of us, like she and I, like my wife and her regular job, they're already cutting hours. I have a good friend who works in another big business, unhealth related. They've already laid them off. So their concern is, well, how long is this going to go on? So economy wise, that's a big
Absolutely.
question. I might have a job, but to
what about the restaurant? Yeah, restaurant owners and just everyone in every field. You know.
And the biggest thing right now that they're teaching us as the home care providers is make sure that if it is not necessary to go out, don't do it. Some people are doing more of the Grubhub, Instacart stuff now, even though it costs more. They're trying to get groceries and stuff that way. The panic buying has gotten a little crazy. I'm not sure what started the whole toilet paper thing, but that's not really one of them. So
I call it the toilet paper raptor. You saw my last video.
One of my friends saw a post saying something about we all need to retaliate by taking all the toilet plungers. So. Anyway, but yes, buy what you need. Just buy what what your family normally needs. It's not at a critical point right now. I know the Trump administration's working on something. I think they're doing all kind of stimulus packages for money. So we'll see if that works. But again, if you don't need to be out, don't be out.
There you go.
What we're hearing is they may make a local mandate to where the police may actually enforce a curfew physically. Hey, what are you doing out? Back you go. So
that's what's being whispered in our area, out here in the Hernando area.
I'm in Dunellen, so over there by Ocala, they're already setting up. I don't know if I'm supposed to say this, but they're starting to set up possible hospital sites for coronavirus only.
Yeah,
people can come in.
Absolutely. So, well, thank you, Robert.
You're very welcome.
And have a good day,
Absolutely.
RN, and our wonderful Ashley, who's here every day, Monday through Friday, with my Aunt Dorothy. Dorothy, you want to say anything? Bye-bye.
Bye.
Oh, you're just chilling. Okay, you just relax. All right, so you heard it from the experts in the medical field. And you got a bird's eye view, or really a good insightful view as to what they're facing during this coronavirus debacle. God bless. I'll see you in a moment. All right, guys, we're back here, YouTubers, family, and friends. And Dorothy has a lot of love and a lot of help from some great girls who come here all the time behind the scenes that you never see. I'm just trying to light it up in here. Although we've got the bright sunshine outside here in sunny Sunshine State, Florida. Here we go again. You may have seen these girls back during the Christmas holidays. You may or may not remember the little 12 Days of Christmas. Wonderful singing. But you met Ashley. There she is, tending to the queen, Dorothy. And here is Corey, and she's her therapist. And she comes in 2 or 3 times a week sometimes. And it's me, Tony Tucker, again, hollering at you. But look at this. She's getting fed her rice and sausage. She's not pregnant, is she? That's an odd combination. With that little sly smile there. And we're looking at her feet look good, but I'm not going to show you her feet. I thought she had her socks on. All right. We'll stop that laughter right now. Okay, well, we're going to get her a pedicure. That's what we need. So we need a pedicurist to come in and do that part. So she'll have, and all we need is someone to wave a palm tree or something. Well, we'll turn the fan on. Okay, that'll suffice. It's a little warm today. It's supposed to be near 90. Okay. Of course, you're talking about the coronavirus, always. So just wanted you to meet Corey if you didn't see her before. She's awesome, working with Dorothy's hands and just massaging her, and she works her entire body, actually, to keep her stimulated and get some strength back in her hands. There's her squeeze ball, her football. Yeah. How's she coming along, Corey?
She's doing great. Yeah. We're just looking forward to getting her sitting up again.
Yeah.
Now
you
help.
Absolutely, thank you. You work in the medical field as well.
I do.
What are you seeing in light of the coronavirus and issues that are going on?
Well, they're actually not letting people in and out of the hospitals, in the rehab facilities. So I know that some of my clients have loved ones in the rehab facilities, and they're not allowed to see their loved ones. So
that's sad.
That's very sad. Absolutely.
That's a sad state of affairs.
So, yeah, I think the whole thing is awful, to be honest.
Yeah.
If I'm being honest.
Be honest.
None of it's a good thing for any of us. Financially, the economy, nothing. And for people that are affected by the virus itself.
Exactly.
So, so everybody's affected. So,
in some way.
Unfortunately.
Yeah.
Absolutely.
Well, thanks for sharing that and working on my aunt's hands. Pulling that, seeing that, getting those muscles. I could use one of those. Look at you.
I used to have a client that she had dementia, and she was losing the strength in her hands. We had to massage her hands and so forth. She had that arthritis as well. So.
If you're looking for more clients, I know your plate is full and overrunning, but Corey, just tell them how someone can reach you. If you have an Instagram, Facebook, or a phone number.
Sure. I have a phone number. I mean, you can call me if anybody's interested. And it's extended care rehabilitation therapy, and my number's 352-848-5117 here in Hernando County.
Say that once again.
352-848-5117.
Thank you. And I'll put a link up there for you.
Thank you, Tony.
Oh, you're welcome. All right, Dorothy, I'll let the queen continue. Resume. Look at her. I should give you a scepter or something. Oh, she's got the queen handshake. Oh, I love my aunt, and these girls are awesome. All right. All right. You're welcome. Stay tuned for more. Our YouTube family and friends, just continuing on, just for you to take coronavirus seriously. I'm sure you are. And to be prayerful, because the prayers of the righteous availeth much through Christ Jesus, not through us. But when we have the faith and we believe, we know that God is able to take this corona and send it back to the pits of hell from whence it came, whether it was experimental, whether it's a distraction from a real deal that we're not thinking about, makes you go, but just to be prayerful and careful. This is Tony Tucker, loving you, praying for you. Pray for me, and remember to like the video, comment, and subscribe, and hit the notification bell and tell your friends. God bless. See you next time.